Welcome back to No Filter Needed. We're here with all three of Verla's providers. So today, excuse you. Sorry, there's a motorcycle or a moped. So today is going to be Q&A. We're going to answer all of your guys' questions so you can have a little better image of what goes on here.
Okay, I can start.
Okay.
One question that I actually get a lot is if I do neck Botox. This was one of the questions that I got. Neck Botox is actually platysmal band Botox. Platysmal band Botox target those bands that we have here usually when we make a movement. Those bands are the one that retracts our lower face down.
I have those.
You're okay. I think you're okay. This is this is mainly for ones that are starting to see.
I do have them.
But you don't have any signs of droopiness in your lower face, so you're fine.
Okay.
This is something that we use to help with lower face droopiness because what happens when we numb those muscles, then it gives a little lift. Those muscles that pulls down are numb, and then it gives a little lift to the lower part of your face.
I didn't know that.
Yeah, it's actually called a Nefertiti Botox, but yeah, that's what it is.
Interesting.
Yeah.
Okay. Next, why does laser hair removal only work on dark hair? I love this question. So the way laser works, what it's doing is targeting the melanin in the hair follicle. So for instance, when you're coming in for laser hair removal, we always want you freshly shaved. The reason why is if you have any hair on the surface, the laser is just going to penetrate to that hair and not all the way down to the follicle. So you're not going to have as an effective treatment. But when the melanin is targeted in the follicle, that's what basically kills the hair bulb for the hair to fall out. So unfortunately, laser doesn't work on whites, blondes, grays, or red hairs, only your dark hairs.
Yeah. The risks for hyperpigmentation, burning when it comes to laser hair removal. Definitely good to go to a provider that knows, that is well educated on the different types of wavelengths and what settings to use for certain skin types.
One question I got is how long after lip filler will I stay swollen? I know it's an important question because a lot of people, once they get the lip filler, they kind of try to plan their week ahead, how many days they'll need to be off, or if they'll be swollen and bruising. So, on general terms, swelling, I always give about a full week for everything to go down. For some people, it's just after 2 days. For some people, it's just after 3, 4 days. But some people actually bruise more significantly than others, so I would recommend for them to just take their time, drink a lot of water, take arnica because that helps a lot with bruising.
And I think when you do my lips, I mean, anytime, it's like a full week for me.
Yeah,
for like all the bruising to be gone.
And this is a lot of people, the majority of the people. It doesn't mean that anything is wrong with you. It doesn't mean anything is wrong with your body or its way of healing. It just means that your body just take a little bit more time to completely heal from the injection, from the procedure that we did. So give or take, I usually give it a week. Sometimes it's just a little bit more, sometimes it's less, but on general terms, 1 week.
Yeah, and to help minimize bruising, avoid blood thinners and alcohol before coming in for your appointment. Yeah, and it'll help a little bit.
Yep.
Next question. I just found out I'm pregnant. Is there any treatments I can still do? When it comes to pregnancy, I like to be safe than sorry. It's not whereas you're at high risk, but there's not really many studies that have been done or performed on pregnant women and if it affects the baby. At the end of the day, there's a human in you, and these are medical treatments, so you're still at high risk. But I would say you can definitely still do facials. I just wouldn't use aggressive AHAs, so I'd probably stay away from like salicylic acids, maybe lean more towards like a light enzyme peel with glycolic acid if you're still wanting to do facials. Laser hair removal, I typically would say no, just because obviously your hormones are out of whack. And when you're pregnant, you can have a lot more hair growth, so your treatments aren't going to be as effective. Now, worst case scenario, if you are struggling with like a lot of facial hair, or like in the middle of like finishing up treatments or whatever the case might be, if you feel comfortable doing laser, we would just require a doctor's note from like your PCP. Just those precautions. What about for injectables with you?
For injectables in general, I would advise against any injectables because, as you said, this topic is not well researched. We still don't know how it will affect the baby, if there's any cross placenta situation there for any of those products, if it's hyaluronic acid, neurotoxin, whatever it will be. So I always advise against any procedure. As you said, there are more conservative treatments that they can
Mm-hmm.
do while they're pregnant if they feel like they really need it. But any of the injectables, I definitely would not want them to do it.
Yeah, I think honestly, like a basic facial, you'll be good.
Yeah.
I wouldn't want to treat anything else.
Rather be safe than sorry, that's for sure.
Yes.
And then, so another question is, how can we help with the bruising, minimizing bruising following certain treatments like injectables or not Morpheus, but any other
Sometimes.
things? Yes, sometimes. Any other things that we have over here. And what I recommend is definitely arnica, which we carry over here inside the office. And you can do 2 pills 3 times a day. So in total, 6 pills. And then we also have a laser treatment. What we do is we're bulk heating a certain area, which you also recently just did. Yeah.
After my dissolved my lips.
After she dissolved her lips, and even during the treatment, we were immediately seeing results. So that's a good option too that we have here.
Yeah, it's actually a great option. Okay, another sorry question that I got. Which technique do you use for the lips? Um, if you want to take in a broader aspect of the techniques, I would say I'm probably using the Russian lips technique. However, I don't feel like in a one technique fits all kind of situation.
Yeah.
I believe more in customizing it according to the patient, what they need, how their lips are shaped, if they need more of a flat lip, if they need more of a plump lip. So every person has a different anatomy, everybody's different. So, in general terms, I do use the Russian technique. This is my baseline, but I
Yeah.
always change it up and I always switch it up with every patient. So, it's more customized for the patient.
Yeah. Like I would be concerned if you did the same technique on my lips, rather as like someone who has like already DSL.
Yeah.
Like it wouldn't look the same or
No.
right at all.
Everybody has different shape. Everybody has different anatomy. You can't just do one size fits all kind of thing. No.
Yeah, no. Okay. Next question I got was I always have texture on my arms and back, almost little bumps from working out. What would you recommend for these? I get the same thing. A lot of it is fungal acne, and that happens from sweating. So if you're sweating too much and you don't have time to like shower right away, the bacteria can get clogged in your pores, causing like little breakouts all over. What I would suggest for body is the Skin Better Alpha Peel Pads. So it has glycolic, lactic, and salicylic in it. It's great for killing anything that's active. So if you do have like that active bacteria on your body and you want to just like dry out all of that fungal acne, use those. And then I would go in with the Alpharet Body Overnight Cream. That is great for texture and crepiness and just having your skin like super smooth. So I would do the conjunction of both to help clear that up. And obviously, consistency is key.
Yeah. Any creams you would avoid?
I would avoid would be like thicker lotions or anything with fragrance in it. Fragrance does cause a lot of acne. Acne is already there, it's just going to clog it even more. And then also what I would recommend is like an antibacterial spray, so like something like hypochlorous to bring to you for your like the gym or any workout classes that you're doing and just spray it after your class and then wipe it off with a towel so you're killing anything that's active right then in the moment.
So the next question is the dermaplaning I do at home the same as when I get it done with you guys? And
That's a good question.
yeah. I feel like this is like a big thing where people are like, oh, I can just do it at home. Like it's the same if I do it at home. And obviously it's not the same if you're getting it done professionally, like in office. We're using a 10 blade scalpel actually. And what we're doing is we're removing the first layer of your skin. All the dead skin cells are going to come off. So it's also an exfoliating treatment. And that, even when you're getting it done with facials, is even going to help penetrate the products that we're using on your skin further of the skin. So You're getting all the vellus hairs, dead skin cells, and you're exfoliating. So definitely not the same as when you do it at home.
Another question that I got is, do you offer Botox for hyperhidrosis? Hyperhidrosis, I'm not sure if you're aware, this is when we tend to
We
oversweat
sweat a lot.
from our hands, and this specifically with people that gets that in, in stressful situations or just in general. So yeah, we do offer Botox for that area, and it's a great solution. It's a little more painful, however, we use numbing cream. But I see great results with people that suffer from hyperhidrosis, and they tend to come back for that every time because it's actually medical treatment for that, and it's a great solution for that too.
What are the areas that you can treat with hyperhidrosis?
Hyperhidrosis, underarms.
Mm-hmm.
Basically, most of the areas that tend to um, oversweat, that you tend to oversweat, we can do, but it has to be very targeted.
Yeah.
So it really depends on the problem, the location, and how bad it is.
Interesting. I feel like I want to do it for my underarms.
I continuously do it for my
Laser
arms.
has
I can't go
helped.
without it now.
Laser has helped a little bit, but I still sweat so much sometimes.
And it helps.
I feel like that's a good treatment, even just to like for like confidence purposes, especially with some people.
Yeah, people that come for
Yeah.
those problems are very, very, very self-aware of that. They're
Mhm.
super conscious about it. And if you're in a relationship, you start dating someone, even just holding a hand is like a big deal for them
Yeah.
because they sweat a lot.
Or even athletes too, like basketball players or football players. You have gloves on, I guess, but like
Yeah,
but they're using their hands a lot. It's a good treatment.
yeah.
Is it when you're doing the Botox, since you're removing like not removing, but like the sweat glands are getting like paralyzed
The
in a way?
neurotoxin has an effect on the sweat glands and on the receptors, which tends to kind of shut it off in a way. But that's obviously for a short period of time, for
Mm-hmm.
however long the Botox is affecting it.
I was gonna say, is does it like long term? Does it affect your health in a way?
No, it does not.
Okay.
It does not. As I said, it's temporary,
Yeah.
and you have to renew it every 3 to 6 months, depends how long it lasts for you. But there's no long-term complication or effect, at least that we know of as of today, for that.
Okay. Next question is, what is the one product or holy grail you would recommend for redness? I would probably go with Maestro Rebalancing Serum from Skin Better. Maestro is great. It's actually the number one product out for rosacea. And it's all plant derivatives, so you have all of your antioxidants in there, and it just helps calm with the botanical ingredients. That would be pretty much my holy grail. Yeah.
Question I have is, how long do results last for treatments like Morpheus or chemical peels? And with anything, you are going to need maintenance, but especially with treatments like Morpheus, you also have to be in conjunction with like a good routine at home and a good lifestyle. And if you really want to see the long-term results, you have to like also do your part. But what I like to say is obviously with a package of 3 to get full results, but even with Morpheus, it's collagen induction. So over time, you're still going to see results because the collagen and elastin is going to be targeted and producing. But even just like a maintenance of like one every year or so, I would say is good. I don't know if you want to kind of piggyback on that.
I feel like average when patients do the full treatment plan of 3 sessions, obviously it could be less or more. Well, not too much less, but it could be more depending on the circumstances and concerns. I like to give an average of about like 2 to 3 years if you are maintaining and like keeping up at home. For instance, I'm saying like don't come in for 3 treatments and then you are not using good skincare and going out in the sun and not wearing SPF, because obviously your results aren't going to last and you're just going to waste your investment, which that's not what we want you to do. We want you to prolong this and have your results for as long as you can. So, yeah, I mean, in maintenance, it varies patient to patient. Sometimes 1, maybe 2 sessions a year. And it really is all about at home care. So that's why skincare is so important, and that's why we use Skin Better.
Okay. Are there any complications to Botox treatment? Um, okay.
I don't know what language that is.
I think it's real.
Okay.
All right. Um, okay. Let's wait for that to pass.
What is happening? I can't tell
I
if he's like
don't know.
dancing or yelling.
I think it's just a simple conversation.
Yeah, I just think he's expressive.
Wow. That was my entertainment for the day.
There's always something over here.
I know.
All right. So, yes, Botox is a medical procedure.
Mm.
Any medical procedure could have complications. Now, complications can be minimized if you're in the right hands, if you would a well-trained injector. There's always can be unevenness. There's always can be some droopiness on one side or the other. But if you're with an injector that you trust and you feel they're doing their job, they know what they're doing, then you should be confident about your procedure. However, if you're going to an injector that you just found, if you're just getting kind of like a budget situation, and most of the times people that get those great deals, they don't even know what they're injected. They don't even know what the credentials are for their injector. So it's very important to do your due diligence to minimize complications, because those can be minimized tremendously if the injector knows what they're doing.
Yeah. Some of them don't even know the name of their injector.
Yeah, they
Oh
don't
my
know
gosh.
what they're injected. More than that, they have no idea what they're getting
Yeah.
injected.
Okay. Let's see here. Next question is, how does Morpheus work for skin tightening? So, Morpheus 8 is microneedling in radiofrequency. So, what this is doing at the end of the day, it helps with skin tightening, fat reduction. You're producing more of that collagen and loss of elasticity. Particularly, skin tightening is normally on the first couple layers of the skin. So, we're really treating like the epidermis and the top dermis layers. That is where elasticity tends to be lost when we're aging. So, what I would do for Morpheus when we're solely focusing on skin tightening is super high RF, which is the radio frequency, and very superficial layers. The reason why is when you're heating up the top layers of the skin, that's actually what's tightening the skin. So think of it as like a broken rubber band that's like been snapped. What we're doing is repairing that rubber band so your skin is like nice and plump again on the surface. Um, and yeah, that's basically how Morpheus works, particularly for skin tightening.
Okay. I actually saw a TikTok video about a girl that was talking about a Morpheus treatment she did, and she kind of did a timeline. And then she said that at the end of the 7 days mark, she started feeling like she's having volume loss, or she felt like she had some areas that are more dented than the other. What do you think happened there?
So, if you are not being treated by a professional provider, or just a provider in general that knows how to customize your concerns, you absolutely can look worse from Morpheus
Hmm.
and have volume loss. The reason why is you have to be able to know your settings and customize whatever part of the area you're treating for its concerns. So, for instance, like I was just saying with skin tightening, if I were to treat that on a deeper dermis layer and go a little bit deeper, the client would probably be left with more loose skin because we're at that point we're burning fat and creating more volume
Right.
loss when her main concern is skin tightening. So when you're creating less fat, you're left with more loose skin. So that is probably what had happened, or they were just using like one bulk setting if it was on her face, for instance. So like a lot of people he have horror stories of like they've lost their cheekbones or like they don't have any volume left in their cheeks. Yeah, or they feel like they have jowls now because the treatment wasn't done properly and they're treating the incorrect layers of the skin, so they can be lost with, or they can be left with that
Hmm.
loss of volume. So it's super important that you're wherever you're going. I mean, there's so many great providers out there. I'm actually a top provider. But you just want to make sure that your professional is educating you. So what I, for instance, do with my clients is I'll take a picture of their face, and then me and Kayla will be like drawing out literally the settings that we're doing on them and explain why we're doing this in this particular area. This is what your end result is going to be here. If there is like a little bit of loose skin, like a lot of post-pregnancy women who have that like loose skin on the lower abdomen area, we're going to go super, super high heat. And they might have fat in another area of the abdomen. So it's two completely different settings. Yeah, basically, moral of the story, just do your research and make sure that your provider is educated and ask all the questions before getting treated.
Even not only just during the consultation are we like educating, but even during the treatment. Yeah, I feel like you do a very good job explaining, like, okay, now I'm going to go, you're going to start feeling a little bit more heat because we're going more superficial, and explaining as we're kind of going through it
Yes.
what to expect. But so, question is, what would you recommend to help get rid of sunspots, hyperpigmentation that I have on my skin? So, living in Florida, I feel like it's kind of inevitable to have sunspots and hyperpigmentation because of the sun and the heat that we like live in. But the first two things that come to mind when it comes to like lasers is definitely like a photofacial or frax, which is a fractional laser. And for the photofacial, I feel like that is really more geared towards like redness and help breaking down those capillaries on our skin, and then more for fracs for just evening out overall skin resurfacing, even pigment, even helping with the texture of our pores and appearance of our pores. But yeah, those are the two things that come to mind.
I have one more. Okay, how do you determine the best treatment plan for a client? I feel like we can all answer this, but I'll start first. So obviously everyone is different and everyone's concerns are different. So when someone comes in, the first thing is tell them we are shooting for realistic results. They come in with unrealistic expectations. It's one, probably already not a good match, or two, we have to explain why we can't achieve this or why this isn't a good fit for you. And the way I do that is our health histories that the patient fills out are very in depth. So I like to ask a million questions. Also, like your medical history, your lifestyle at home, how long these concerns have been up for, or if they just recently appeared, and what are you looking to be at for the end goal. All of those things factor in, and you want to ask as many questions as possible because that's where the best results are going to be. So that's what I normally do. And then I'll start it off with, like, okay, this is going to be the best thing that we can do for you. And this is X, Y, and Z treatments. This is how they're going to be spaced apart. This is the downtime. This is how often you come in. And this is when you'll start getting results. Or we can start at like a basic, whereas like we don't have to do everything at once. We can kind of maintain it. And then worst case scenario is like, okay, we can just start maybe like get your products, start putting your skin in like a new regimen and before getting treatment, so it can be like maintained and you have better results while getting treated. But everyone's different, so everything's customizable at that point. I just always like to ask what they want first, their background, and then that makes our job easier to give you results and realistic results.
Correct. I I agree with that. Yeah, for me, I feel like it's always important for me to understand first what the patient is looking for, what's their plan, what's mostly concerning them. Because sometimes what I see is not really aligned with what they see or what they're bothered with about their face, about the structure, or whatever it will be. So it's very important for me to first hear what they want to achieve, what they want to get, what they're looking to improve. And then by that, I start to customize the plan for them. If it's a combination of fillers and Botox, if it's just fillers, if it's just to correct symmetry, balance what needs to be balanced. So of course, Every patient is different, every plan is different, but I always go around what the patient is looking to achieve more than what I think they should get.
Yeah.
Right. And along with asking like lifestyle and kind of just their day to day, I definitely think that, like what you said, a lot of people come in here saying they want this, they want that. And when, as we're sitting down talking to them, we kind of start thinking that we have a better idea of what might fit their concern. So it's kind of just like getting that conversation going. And then from there, giving them options. And I feel like, especially when you give options, it gives them like like a sense of, oh, I'm not just trying to sell you on this one thing.
That, and two, going off of both of you, there's been so many times where people come in thinking they need microneedling or something, but realistically, they end up needing filler or Sculptra or Botox and neuromodulators, and then vice versa. People come in wanting filler, but they probably need to start off with Morpheus first to help tighten and build that collagen before doing filler for better results. Now, we're always going to give, obviously, your best treatment plan, but not in everyone's budget. And if someone doesn't want to spend a lot or want to basically take it step by step, we also give them those options as well. So we like to work with everyone, and we don't look at this as obviously a sale or anything like that.
Yeah.
This is making you feel better, making you feel like yourself, just in a youthful version, and making sure that your investment is going to be worth the rest of your life.
Right. We're patient oriented. We care about how you feel when you leave here. We don't just want to do whatever needs to be done and send you away. We want you to come back. We want you to be happy with whatever you're going to get here. So we're very much patient oriented. And if it's a combination of all of us together during the treatment or whatever it will be, for I think that my patient doesn't need a filler or Sculptra, or maybe she just needs laser treatment, then we'll do that. It's not about us just looking to get something done. It's us looking to make you happy.
Yeah, no, absolutely. And even if you come in and wanting everything, sometimes it's like, okay, I don't feel comfortable doing anything on you because you literally don't need anything right now. So we can do like a facial or microneedling or a peel. Like, when someone comes in wanting something, it's almost like at first you feel bad telling them, but then the minute you say no is the minute I feel like patients build trust. Because I could say yes to everyone and anything, and then I could have people looking botched all around. And
Yeah.
if you do say yes to everything, you're really not a professional at that point, because you're just doing whatever floats the boat for the patient.
Correct.
And not everything's like a one size fits all. Everyone's bodies are different, everyone's skin is different. So that's why it's important to come in and we can take a look. We do free consultations. So it's really good to sit down with someone and really figure out what's bothering them, what they want to improve. And like that we can tailor something that's more geared to that specific person.
Yep.
So that was it for today. A nice little frequently asked questions from all of the providers over here. And yeah, so we'll see you next time. Bye.